This topic is postpartum depression. So postpartum depression is a perinatal mood disorder that occurs due to fluctuations in estrogen and progesterone immediately after birth, and symptoms usually occur between 4 to 6 weeks after delivery. The clinical features of postpartum depression are very similar to those that you see in major depressive disorder, but you will also see some that are related specifically to the mother and baby bonding. So you'll see things like angry outbursts, sleep disturbances, either sleeping too much or sleeping too little, spontaneous episodes of crying, feeling of irritability, sadness, and then specific to pregnancy and postpartum, feeling like you are an inadequate parent, having different food cravings, a lack of interest in the newborn, or the most concerning, thoughts of harming the newborn. So those of you who've had a baby before know that the postpartum period is very difficult. You have a brand new newborn, you're not sleeping, you're not eating, and there's a lot of changes that are going on. So things that are risk factors for that are things that kind of exacerbate those feelings. The most important is going to be a history of depression either before or during the pregnancy, and then factors that kind of help continue to isolate you during the postpartum period. These include having an unintended pregnancy, maybe not having family support, or being in an abusive relationship, having a bad pregnancy outcome such as a stillbirth, or even something like having a cesarean delivery when you weren't expecting it, and sleep deprivation. I think, though, the most important thing that you need to know about postpartum depression is, even without any of these risk factors, postpartum depression is very common, and a lot of the symptoms overlap normal postpartum experiences. So all women should get screened for postpartum depression during their postpartum visit with a depression screening tool such as the Edinburgh postnatal screening. And then you need to evaluate, like anyone with a depressive disorder, thoughts of harm for themselves or someone else, particularly their baby. Treatment includes starting antidepressants and then potentially doing either group therapy or psychotherapy.